So some of the symptoms that people with lung cancer can experience include pain, breathlessness, cough, loss of appetite and loss of weight, and low energy levels, which we refer to as fatigue. And when we say symptoms, we're referring to something that the patient feels. So it's a physical condition that reminds the patient that there's something wrong. And it's usually something that's bothersome or stops the patient from doing what they want to do.
On the right, top right, my lung always got something to punch in and they put down, like I play with the young elephant and I fell off, and then they put one feet in and they lift, and they put in, they lift. So every time like this, in about a couple of minutes, I very pain, very pain.
I always was short of breath, but I put it down to the smoking. That's what I put it down to, for smoking for all those years. The shortness of breath, and I think the health service did too, because I was such a heavy smoker.
People can often be very frightened if they've experienced something new that's causing them some distress. And breathlessness is a key symptom that can do that. So in addition to cancer treatments, we know we've got some very good medications that can help make it better and more easy to live with. But importantly, we can also teach the patient and their families little tricks that they can pull from their bag of tricks at a difficult time to help them get on top of their breathlessness in addition to what we can do. And it's with very easy retraining, and we can give you a little pamphlet to read. You can practice at home, no one need know you're doing it. And then when things get a little bit difficult or you're in a stressful situation, you can refer back to what you've learned.
You're just going to cough and cough and cough. Like I cough sometimes, I just about throw up. And, you're just trying to cough something up and nothing's sort of coming up, and, it drives you nuts.
One of the more common symptoms that lung cancer patients develop is shortness of breath or breathlessness, or doctors call it dyspnea. This can usually be very well managed with small doses of morphine, given either by mouth or by injection. And also there are other medicines that can be of great assistance.
And trying to find something for her to eat. I thought, well, she'll be able to get scrambled eggs down. No. Poached eggs? No. Mashed spuds? No. I can't remember how we got onto the Kentucky Fried mashed potatoes and gravy, but I tried Deb and homemade gravy. No, but the Kentucky Fried was the only thing she could eat for quite a long time.
It stayed down.
It stayed down.
Well, I was so thin and I was so tired, and we lived in a big old farmhouse with stairs, and I was having a terrible struggle just trying to get up the stairs. And I mean, we were running a cattle farm, and I used to do everything with my husband because it was just the two of us, and I just couldn't cope with going out in the yards, and I just was ill. And of course I didn't know why I was ill to start with.
Chopping wood, I split a few bits, and I got to sit down, like anything that I have to do that's physical. So, I can chainsaw wood though still, it's not so bad using the chainsaw. But chopping woods and mowing lawns and just doing gardening in general. Sort of can only do it for a while, and then I've got to rest and get my breath back.
And it didn't happen quickly. It was a slow thing. I mean, you don't lose weight all of a sudden. I hadn't realised how thin I was.
Extremely tired, and a lot of nausea. But I overcome that by walking and just saying this is not happening.
So the main thing to remember with any physical symptom that the patients experience, there's always something we can do to make it better.